Hi, I'm Dr. Well, and this is Baz and Rav.
Baz and I have been around for a while doing other things, but now we're teaming up to take part in a trial to fight COVID.
Our latest adventure is called Tactic R, and it's all happening right here in Cambridge.
And it all started when some doctors in Cambridge wondered if some COVID patients were getting so ill because their immune systems were backfiring.
We've all got an immune system. It's a group of cells inside our bodies that work together to fight germs and viruses, like those that cause COVID, that make us sick. In other words, it's on our side and helps most people who catch COVID get better.
But for some people who catch COVID, a small minority, it also starts fighting against us, killing off not just germs, but damaging parts of the body, like our lungs and other organs. This is very bad news, making some people very sick.
Our group of doctors then wondered if medicines that we already use to stop immune systems fighting against the rest of the body could help these patients.
They spent hours researching lots about COVID before selecting two medicines, Baz and Rav, which they believe have the best chance of working. This is what Tactic R trial is testing.
The R stands for repurposing, which means changing jobs.
Currently, Baz and Rav are used to treat other conditions. Baz for rheumatoid arthritis, which is a pain in your joints, such as your knees and elbows, and Rav for rare blood disorders. The doctors notice COVID-19 affects our immune system in a similar way to conditions Baz and Rav normally try to fix. So we asked them to help us fight COVID-19.
Right, let's get one thing clear. My real name is not Rav, and Baz's real name isn't Baz or even Barry. We're actually called, wait for it, it's a real mouthful, Ravulizumab and Barry Citinib.
Let's just stick to Rav and Baz, shall we?
Doctors know a lot about us, including how safe we are. In fact, they've been using us with patients for ages.
Like all clinical trials, in Tactic R, doctors study actual patients being treated for COVID in hospital. Clinical trials are run so we can find out which medicines and treatments work best. And the more treatments that doctors have for COVID, the more chance of a complete recovery.
By spring 2021, more than 400 very poorly COVID patients were taking part in Tactic R.
Doctors are comparing test results from patients who haven't yet met me or Baz with those from patients we are treating. It already looks like we can help very sick patients.
That's great, but don't forget to mention the most important thing. A big thank you to all the patients with COVID who are helping doctors and nurses to fight this terrible disease by taking part in clinical trials like Tactic R. Without them, none of this would be possible.
And thank you also to all the clinical and research staff working on Tactic, and to all NHS staff working to keep patients safe. Big virtual hugs.
I've learned that trials to find new medicines are important. Cambridge doctors and scientists are working really hard to find ways to make people better and stop them from getting so ill.
Thanks for watching.
Stay
safe, everyone. Bye.
Forgot to say, we have a great quiz and colour-in sheet for kids to download. See the link below. Well, time for us to get back to work now and show COVID who's boss.